Many people lose their lives due to strokes. Surely, this was fate from the beginning. But it's frightening to know that many could have survived if they had enough awareness of the symptoms indicating an impending stroke before it's too late. In this video, we'll learn all about strokes or cerebral infarctions, starting from defining them and how they occur, passing through factors increasing the risk of getting one, and learning how to easily recognize its symptoms. Finally, we'll provide tips to help you reduce the risk of stroke or cerebral infarction. But before we begin, don't forget to subscribe below the video and activate the notification bell to receive our latest updates. And leave a comment so we can continue sharing topics that interest you. So, what is a stroke? A stroke occurs when there is a change in blood flow through the brain. And in other cases, it can occur due to a blood clot or blockage in the arteries, or even in cases of damage to the blood vessels themselves. It's known that blood carries oxygen and nutrients to the brain cells. If blood cannot flow properly to a brain cell for some time, the damage that occurs to that cell cannot be repaired. And if this continues for a long period, the cell eventually dies. However, if a brain cell is deprived of oxygen for only a short period of time, it can repair itself. Strokes may seem sudden and rapid, but there are warning signs that precede them. These symptoms include, firstly, sudden weakness. One of the most important signs alerting you to the occurrence of a stroke is sudden weakness or numbness on one side of your body. Whether it's two arms, legs, or faces, for example, if you try to lift your arms, you may have difficulty lifting one of your limbs. And if you try to smile, one side of your face may respond, while the other seems droopy or sagging downward. The same applies to attempting to walk. In general, a stroke can lead to complete paralysis of one side if its severity increases. Second, sudden confusion can indicate a stroke, causing sudden confusion in performing tasks. For example, if you're having a conversation with someone, you may find it difficult to speak or be unable to speak at all. Or if you're typing on your computer, you may not be able to find the words, as if your body has lost communication with your brain. Many people experience cognitive impairment as they age, which is entirely normal. But if you suddenly notice some sudden confusion, you should be concerned about it. This temporary loss of cognitive function occurs when blood flow to the brain decreases. Thirdly, a sudden change in vision is considered a significant symptom of a stroke. Where there is any change in vision, whether difficulty or loss of vision itself, is important. As the image suddenly fades or you begin to see things around you blurred. Fourthly, a sudden loss of balance accompanies weakness or numbness on one side of the body, leading to dizziness and loss of balance. Fifthly, a sudden, severe headache, accompanied by dizziness or nausea leading to vomiting, may indicate a stroke. This symptom may overlap with other problems. The headache caused by a stroke is unusually severe. Some people may confuse this headache with a migraine, especially if the person experiences migraine attacks from time to time. However, you shouldn't rush every time you feel a headache. But if it persists with the same intensity for several days, you should consult a doctor. Other symptoms that may be caused by a stroke include sudden, severe fatigue, difficulty perceiving what's happening around you, or understanding what others are saying, in addition to losing the ability to coordinate movement, difficulty swallowing, or even loss of consciousness. Now let's come to the most important element. What are the steps to reduce the risk of stroke? As a general rule, there is no recipe yet to prevent a stroke, but there are steps that can be taken to protect yourself and reduce the risk of it. They are as follows. High blood pressure is the leading cause of strokes, and the most important factor that can be controlled to ward off the risk so try to keep your blood pressure within a healthy range. If you suffer from diabetes, whether type 1 or type 2, you should know that diabetes increases the likelihood of a stroke. So you should monitor your blood sugar levels regularly. And if you're not diabetic, make sure to avoid factors that can lead to it. High cholesterol levels in the blood can lead to its accumulation in the arteries, increasing the risk of heart disease as well as strokes. So you should undergo the necessary tests to ensure there are no problems with the heart, or establish suitable treatment plans if tests reveal any issues. Regular tests should also be conducted to monitor your cholesterol and lipid levels, and most importantly, follow a healthy diet free from saturated fats to reduce cholesterol. If you're a smoker, now is the time to quit smoking to protect yourself from the dangers of strokes. Maintain a healthy and moderate weight. And if you're overweight, you should act quickly to lose the excess weight. Try to exercise most days of the week. And intense exercise isn't necessary. Even regular walking will be beneficial for you. Share in the comments about any positive rehabilitation experiences you've heard of or lived with someone who was diagnosed with a stroke and recovered from it. Stay healthy and well.